name is Nadia Lappa, and I'm a mother, wife, daughter, sister, and friend. I was diagnosed with spontaneous coronary artery dissection, or SCAD. My heart journey began in 2016 when I was 37 years old and just gave birth to my third child. One day, I felt a surge of anxiety and the need to flee, to be away from people, and I became violently ill. And I found myself laying on the floor of a public washroom. Paramedics were called and I was rushed to the University of Ottawa Heart Institute, where I had 2 heart catheterizations. The doctors had to open up my right coronary artery to keep the blood flowing and to stop the heart attack. They did this by inserting 3 stents, which are like expandable coils made of metal mesh to treat the blocked coronary artery. After a few days, things got worse and I went into heart failure. The left side of my heart wanted to keep beating, but the right side just quivered. This caused incredible crushing pain, and I couldn't stand up without collapsing. I spent several weeks at the Heart Institute in the critical care unit, and the heart failure team successfully got my heart beating regularly again. I was diagnosed with a rare type of myocardial infarction, a heart attack, caused by spontaneous coronary artery dissection, or SCAD, which in my case was likely attributed to elevated hormone levels over multiple pregnancies, which affect the integrity of the interior of the artery walls, making them fragile and subject to tearing. It took 2 years to get back to my usual life and routine. I follow recommendations from my doctors in terms of healthy habits, lifestyle, medicine, and exercise, and they are really happy with my progress and recovery.
In support of WearRedCanada, here with us today is Dr. Alexandra Bastiany. Dr. Bastiany is an interventional cardiologist at the Thunder Bay Regional Health Science Centre and a faculty member and clinical lecturer at the Northern Ontario School of Medicine in Thunder Bay, Ontario. Today, we have the pleasure of briefly talking to her about the women-specific information and challenges faced in dealing with this health matter. Thanks for being with us today. Nadia mentioned in her story that she was diagnosed with spontaneous coronary artery dissection, SCAD. What are the causes, and is this condition common?
Well, SCAD, or short for spontaneous coronary dissection, is a separation of the coronary arterial wall. The arterial wall has 3 layers, themselves containing smaller vessels. When a bleeding occurs in those small vessels, or when there's a tear in one of the wall layers, it causes a hematoma, or a bruise, in the arterial wall. In most cases, a predisposing arterial disease association or cause is identified. However, in up to 20% of cases, no cause is found.
What symptoms can people present with?
Patients with SCAD usually present with symptoms and signs of acute myocardial infarction or a heart attack. Chest pain is the most common symptom presentation in 96% of cases. Less common symptoms include arm pain, neck pain, nausea, vomiting, sweats, shortness of breath, and even back pain.
What sort of treatments are available for this condition?
Usually we have a conservative approach with patients presenting with SCAD. Of course, if the patient is having ongoing symptoms, if they're unwell, or if they're not stable, intervention will be needed. For example, a stent. In most cases, we treat this condition with pills. Patient will be on lifelong aspirin and a beta blocker, which is a drug that slows down the heart rate.
If an individual is concerned they may have or have had SCAD, what should they do?
They should call the ambulance. At this point, it should be considered just like a heart attack. Next stop, emergency room.
Thank you, Dr. Bastiany, for the valuable information you shared with us today. We want you to be mindful, curious, and proactive in the management of your heart health and wellness. Because to take care of others, you need to first take care of yourself. To learn about the unique aspect of heart disease in women and what you can do, visit WearRedCanada.ca or speak with your healthcare provider and join us on February 13 for WearRedCanada.